Inside story of tooth cavities and gum disease. Who will benefit from this presentation? Nearly everyone who will watch it with interest. There are two main dental diseases, that is dental cavities and gum disease. Both are caused by the bacteria in the mouth. Bacteria lives in everyone's mouth. The aggregation of bacteria is called dental plaque. This is a visibly clean mouth, but the plaque can be seen in the disclosing solution. Disclosing solution, the dark area is the dental plaque. Plaque is a concentration of bacteria, and bacterial proliferation plays major role in starting as well as progression of dental diseases. Let us see plaque in a meticulously clean mouth, and later pick some plaque and take it under the phase contrast microscope to see the living bacteria. This is an educated young patient with good dental awareness. She has sparkling teeth. After disclosing with plaque disclosing agent, she shows very little plaque on the front teeth as she has brushed in the morning before coming to the dentist. That's me. Whereas on the lingual, that is tongue side of the teeth, she has missed brushing. Same is true for the left side. Bacteria also lives protected on the tooth surface just below gum margin in the space called gingival sulcus. Let's concentrate on this tooth. It has very little plaque. This plaque has been collected from the gingival sulcus. Very little of this plaque is taken on a slide. A very little portion and a very little more portion, and then add some water into this. This is what we see under the microscope. Cocci, these are the rounded structures. There are some small rods also. Let us follow a small rod. Look how it's running. These are all living microorganisms. Now I will change the background. So they are mainly cocci, the rounded structures. Now I'll show you a few rods. These are the small rods. Initially, what happens when the bacteria deposit on the teeth, they are less in number. When they are less in number, all of these bacteria get oxygen. So they are called aerobic bacteria. That is, they live in oxygen, and each one, because of less population, gets enough oxygen. But as the time passes and the person is not brushing or brushing inefficiently, what happens is another layer deposits on the first layer. The first layer that was deposited does not get the oxygen. So they learn to live with oxygen as well as without oxygen. They are called facultative organisms. Now let's go further. Another layer deposits. Now when another layer deposits on it, the lower layer doesn't get oxygen at all. But the bacteria change. There is a bacterial succession from aerobic to the anaerobic bacteria. These anaerobic bacteria now lives only without oxygen, and these are the one which gives bad smell and the main cause for dental cavities and the gum disease in the body. And as the number increases, they become small rods, and then if you are still not brushing, they become long rods. And in extreme cases, when the person is very bad oral hygiene, they have a lot of spirochetes also, like snake-like structures which are moving. Now these anaerobic bacteria cause smell in the mouth. Now let me take to the real life situation. Imagine then when you were young, or when your children were young and they have come to you in the morning for a morning hug and love, and they were smelling, and you tell them, go away, brush a little or do gargle and come back. And the same person you give a hug to him, and then same time is not smelling. So it's like that. They have become anaerobic, and the anaerobic bacteria overnight multiplies, and these give bad smell. Now let's take this on curd. Curd also has bacteria. They are lactobacilli. Now you leave the curd on the table, particularly in the summer for a day, it starts smelling. It smells what? It smells because the number of bacteria has multiplied and they have become anaerobic. Now I'll show you the bacteria under the phase contrast microscope from a relatively clean mouth to the one which has not brushed. The first one I'll show you from a clean mouth. These are mainly cocci and very few rods. Now I'll show you the bacterial change or succession where there are lots of rods from a diseased mouth. There are short and long rods in abundance. Now, knowing the fact that the bacteria are the cause of dental disease, we should try to reduce the number of bacteria in the mouth by meticulous cleaning.